All right, well, this is kind of an interesting morning. Usually when we have things like this, the room is full, but it's also a good thing that we've got folks chiming in, Facebook Live and those types of things to get more information. We've heard from several of our members in the business community that just had questions, and so we wanted to help put some of those at ease, and our friends at Henry County Medical Center had some of those answers, and so we thought this would be a good opportunity to get them in front of the business community and our members and help answer some of those. Some of the other questions that we've had that I wanted to go ahead and address, a lot of folks are calling saying, hey, I need help with cash flow. Hey, I need help with these types of business things. And the biggest advice that after I've talked to several people is reach out to your local banker. Your local banker can help you in those areas, can help you navigate through the Small Business Administration and different things that are going to become available through the government. So reach out to those folks. That's what they're here for. They're at their office. So reach out to them and they'll be glad to help. I also want to make you aware that tomorrow we're going to be putting some things up, some resources for businesses that are still open. We're going to start with some restaurants that are doing curbside pickup and those types of things. We're creating a live Google Sheet where you can see, are they open for dine-in? Are they open for carry-out? Will they do curbside and delivery and those types of things? So be watching for that. That's going to be available. If that goes well, we'll start expanding that into other industries. But I know a lot of folks were curious about what restaurants and those types of things. So we're going to start there. And I do want to say thank you to the hospital. Lisa, you guys have done a fantastic job. This is an uncharted territory for all of us. And the response that you guys have put together for all of this doesn't happen overnight, and so it's neat to see this work, see the years of preparation, the teams that have been assembled for years, and how they're reacting quickly to policy and procedure changes. And they've reacted well so far. So at this time, I'm going to turn it over to Lori Stambon. She's going to give you guys some information, and we've got several other speakers as well.
Thank you, Travis. Hello, everyone. I'm just going to give you some general medical information about coronavirus. I do want to stress to you that when you're looking for your information out there about this, that you are looking at credible sites. The ones that I think are the most credible is the CDC website, Tennessee Department of Health, as well as the World Health Organization website. And you can get links to those from the hospital's website that will direct you to the CDC and the Tennessee Department of Health. Everything that you're seeing on Facebook is not necessarily true. Facebook, Twitter, even some of the stuff that I've seen in the media is not necessarily factual information. So I urge you just to stick with the facts from your reputable sources. So what I'm going to tell you today is what we are getting from all of these reputable sources. But I want you to keep in mind that this is changing. So because I tell you something today, a week from now, there may be something a little different because this is something new. The coronavirus that we are talking about today is the new or novel coronavirus. It's the one that's only been around for about 3 months. It is not the one that has been around for years. Like there's a regular form of coronavirus that has been around, first identified in the 60s. You may have heard people talk about that it says on the Lysol bottles that it kills coronavirus. That is the coronavirus that's referring to. This one that we are dealing with now is a new strain of it, if you want to call it that. The illnesses that have been reported with this have ranged from very mild illnesses, such as your fever, the dry cough is what most people are getting, going on to severe illnesses where it develops into shortness of breath and pneumonia, which require hospitalization. Usually the symptoms appear about 2 to 14 days after exposure. The good news is that 80% of people that are contracting this so far are recovering with only a mild version of the illness. However, the World Health Organization says that 1 in 6 will become seriously ill and develop problems breathing. So those are the ones we're really mainly, we're concerned about everybody, but those are the ones that we're focused on in the hospital to take care of. Greatest risk, of course, if you've traveled to any of the high-risk areas, you are at a greater risk for it. Or if you have been in prolonged contact with someone who is diagnosed with it, then that, of course, puts you at a greatest risk. Risk also, if it were to become in our area, the elderly, people over 60, especially over 80, ones that are very frail, that puts them at an even greater risk. Anyone with heart conditions, lung conditions, diabetes, that automatically puts you in the high-risk category for complications from it. And if you're an older person with any of those diseases, then you're at an even greater risk. So these are the people that we want to protect. I get it, my kids get it. Chances are we're going to recover and be fine, but we don't want to spread it to all of these other populations that are not going to be fine. And we don't want them to overwhelm our healthcare system. Transmission, they believe it's primarily transmitted by respiratory droplets. They do not believe that it can be suspended in air, that the droplets go about 6 feet and then they fall to the ground. And this is what they are believing now at this time. There is a chance that it could be spread by touching something that someone else has touched that has it. But they do believe that the primary mode of transmission right now is by respiratory means. So that's why we're having all of these precautions out there for people. So we're going to start with what you can do to prevent it. The number one best thing you can do is wash your hands, y'all. This is nothing new. This is something that we've always known to do to prevent disease. You've got to wash them, and not just wash them, you've got to wash them well. For 20 seconds at least. And you got to really scrub. You got to try to get all of those microbes off, get underneath your fingernails. It's not a quick, put some soap on there and do it real quick and rinse and go. It's a full-on 20-second scrub. That is the best thing that you are going to do for yourself. Hand sanitizer with at least 60% alcohol is your second best line of defense. Okay, hand washing is best. When hand washing is not available, use your hand sanitizer. Take your hand sanitizer with you everywhere now. Avoid touching your eyes, your nose, and your mouth, because if you've got something on your hands, those are the ways you transmit stuff into your body. Cover your cough or sneeze with a tissue. Throw that tissue away immediately. If you don't have a tissue, cough into your sleeve, just anything to keep your respiratory droplets from going into the air and possibly infecting other people. Clean and disinfect your frequently touched objects and surfaces. Probably want to step that up a little more now than what we normally do. CDC does not recommend that people wear face masks, okay, in the general population. If you are sick with coronavirus, then yes, you need to be wearing a face mask when you go, if you have to go to your doctor's office for any reason. Healthcare workers who are caring for people with coronavirus, or if you have someone in your house that you are caring for, then yes, you need a face mask. But generally, just to run to the store to get your supplies that you need, you do not need a face mask on if you are healthy. And I will say with that unless you have been told by your physician, okay, because there are some people who are immunocompromised out there that their physicians will tell them anyways this time of year, because we're in the midst of flu season, to wear a mask if you go out in public. But for the general population, it is not recommended. They are recommending, especially for the higher risk people, that you stay at home unless you have to go out for your supplies. Avoid crowds. The government, I'm sure everyone knows, has issued now for the next 15 days. They want us to avoid groups of 10 or more congregating together. They're wanting us to stay out of restaurants, public places, anywhere that it's not necessary for us to go. If you do have to go out, keep a safe space between yourself and others. Think about that 6 feet distance, okay? Wash your hands often. Take your hand sanitizer with you. And these are all the things that we can do. If you are in the higher risk, just make sure that you are prepared at home. that you have, a couple weeks supply of supplies for your house. That doesn't mean go buy up all the toilet paper, but just have enough to sustain yourself at home for a few weeks. And if you are to get infected with it, your doctor and the local health department will guide you as far as what you need to do at that point, okay? Right now, and this is from the CDC website, for the U.S., we have 4,226 cases that have tested positive and 75 deaths. In the state of Tennessee, and this is as of 2 p.m. yesterday, the Tennessee Department of Health updates this site every day at 2 p.m. We have 73 positive tests in Tennessee. The majority of those are in Williamson and Davidson County. The good thing for us right now is that we have not had any cases reported in Henry County, nor any of our immediate surrounding counties that touch us. So that's a good thing for us right now. But we just need to stay diligent in our efforts to keep this from spreading to others, especially those that we know are at a greater risk. Okay, I'm going to turn it over to Lisa Castile now. She's the CEO of Henry County Medical Center, and she's just going to talk to you about some of the stuff we're doing at the hospital.
Okay, thank you so much for inviting us out today to have these discussions with you. And let's start with what are we doing at our hospital. We have changed our visitation guidelines, and these visitation guidelines have been changed to protect you as patients, to protect you as the community, and to protect our staff who are working to care for you. We definitely want to keep our staff working. So again, these visitation guidelines are not to be cruel and unnecessarily put upon someone, but they're meant to be measures of protection. Our visitation policy currently, and let me back up and say, our visitation policy is changing frequently, so please check our website for our latest visitation information. But as of today, our visitation is no one under the age of 18. No one under the age of 18 should be visiting our campus unless you are an emergency patient that needs to be seen, you're having surgery, you're an inpatient, one of those measures where you are a patient yourself. But otherwise, no visitors under the age of 18. Secondly, our areas of entrance will be limited to the two main entrances, the drive-through area up front, and then also the walkover on the bridge is an entrance, as well as the ER. The two front entrances will be open each day from 5 a.m. to 6 p.m. Those doors will be locked at the front at 6 p.m. The ER is always open, 24 hours a day, 7 days a week. Within our hospital, the critical care unit has certain visitation hours. We are limiting those hours, and they also only allow 2 visitors per day in our critical care unit. You will also be screened upon entering the critical care unit, questions asked and temperature taken. You will be asked to wash your hands upon being there as well as leaving there. In our women's center, we also have a limit of 2 visitors per patient as well. The rest of the hospital, we ask for minimal visitation, and again, also the under 18 age to refrain from being visitors. So again, please visit our website on that, and please watch for future updates. Some of the other hospitals in the Kentucky area have gone to no visitation. Our healthcare center, our nursing home, is no visitation. I don't want to misspeak, but I think all nursing homes are on a no visitation. So you may want to check with your local nursing home before visiting them. That may be their policy. I know that is ours. What else can we talk about? Lori mentioned that there are no positive cases in Henry County as of this moment. There are no positive cases in the 5 surrounding county areas. We also look at Madison County, which is Jackson, Tennessee, and Montgomery County, which is Clarksville, because those are two large cities that are on the outskirts of us, not adjoining us, but close enough by. They also do not have any reported positive cases as of this time. So please check those websites for information. We are here to care for you. We also are putting in place some of our plans for the what ifs. That's what we have to do in situations like this, because a pandemic has been declared, and we are activating certain things in our hospital to plan for those what ifs. We hope the what ifs don't happen, but you will notice that we have a MASH tent set up on our hospital campus. This is a tent that we have for emergency measures, and we have set that up. It takes a couple of days, so it is ready to go with power, water, all those types of things. We finished all of that yesterday. We don't want to be setting that up in the midst of a surge or an issue in our county. So that is established now. We're working through our staffing plans. We're ready to go with that. We are just weighing that with the needs in the community and the supplies that we have before we activate it. We have talked with area primary care physicians as well as our ER physicians and talked about the possibility of a respiratory clinic and when to do that. So again, working in conjunction with other providers in our community and our ER and watching to see how things escalate in our community. Right now, there's not a overwhelming escalation in our community that our providers and our ER cannot handle. So that MASH tent, again, is set up for precautionary measures and to be prepared, and we'll activate it if we need to. We would call it a respiratory clinic, and we would only screen and test and see patients who have respiratory illnesses, and that would include RSV, flu symptoms, any of the coronaviruses, as well as strep. We would include strep with that because a lot of times folks have strep when they also have those other symptoms. And again, we would activate that and have that available. We already at our facility provide for outpatient testing of coronavirus or COVID-19. We do this in conjunction with the providers in the community as well as ourselves. If someone believes that they are symptomatic and they've seen let's just say that they've seen a physician and the physician says, yes, I want to order a test, they can write their orders, call us. We've given all the practices this information. There is a direct line to call us and say, hey, we're sending someone over with orders, and they have told that person to stay in their car. They are not an emergency patient. So let me phrase that correctly, that these are for non-emergency patients. They stay in their car, and we do test collection. We collect those tests from them and then send them on to the lab to be tested. So we do offer that already, and I think that's great for our community to, again, try to keep folks out of the ER and out of clinics who don't need to be there. Okay, with that, I think that's a lot of information about what we're doing, and please stay tuned to us, again, on our website, on our Facebook pages. We are also sending information out to the press, to the PI. They've been very good to work with us to print information in the paper, and it's also available on their online site for you to read there as well. Yes, ma'am.
What about supplies? How do we stand on gloves and gowns and PPE and all that?
Yes, ma'am. We walk through that every day to see where we stand, and we stand with a certain amount of supplies. We have gloves, we have gowns, we have things to continue doing our ordinary business. We only have a certain amount of the N95 mask, and that's where we are. We have those. We have put provisions in place to say that we will use our N95s when we have a positive test, and secondly, when a provider says there is a high-risk patient that we have put in the hospital, admitted to the hospital, and are testing. Those are the two scenarios of when we would use our N95s. All of our clinical staff is fit tested with an N95, and then we have some extras. So we're working through how, with the state, with our purchasing group that we purchase through, when do new orders come back to us and replenish our stock? I wish I had an answer for that. Yesterday, talking to the state, talking to our vendors, yes, we can order them, but it's when we receive them, it's uncertain at this point. I did notice last night on the news that the military has agreed to give the health system in the United States certain supplies. So that was released last night. So will those supplies come here to me? I don't know the answer to that, but that's very, very helpful to put supplies out there to all the health system. It is taking anywhere from 2 to 5 days to turn test results around. We were initially told 2 to 4, but we're seeing into that 5th day now to get test results. That's more than likely because of the number of tests that are being processed and done. So it does take time to get that information back. Your provider would be told that information. Should you have a positive test result, the provider would be called and they would call you and discuss that with you. Any other questions? Okay, thank you. And Billy is going to join us now and talk about some of the implications from a human resource standpoint.
So from an HR standpoint, the first thing we want to do is make sure that your employees are calm. We want to make sure that they understand that there are provisions being put through Congress right now that should help with the financial potential of financial issues that could happen. At the medical center, we have actually made an addendum to our sick and PTO policy. Currently, we have both two different banks for that. We're allowing our partners to use those. We're allowing them to go in the hole if they need to, based on certain circumstances. You want to look at, self-isolating if they do come in contact with someone, and you want to self-isolate them should they contract the virus themselves. We know that they're being quarantined for 14 days. So we are also looking at that. Another thing that kind of falls in that bill is childcare. That's a huge issue. When the schools are closed, that's one thing, but when daycare start closing, that's a whole nother ballgame sometimes. So we're looking to see, what can we do to help those things? And that is covered under that new bill if it passes, that those items are covered and that you do have certain regulations that you have to provide as far as paid sick time. As I look at the bill, and it's constantly changing, I know it will make more changes, I'm sure, before it's finally signed, but it does apply to companies under 500 employees. So those over 500 are kind of exempt from some of these, which is a huge population of employees in our country. And then if you're under 50 employees, you are kind of exempt from this as well. So I think they're putting a lot of things in place to help workers. And again, I know us currently, we're trying to do our best to take care of our employees as they need that. One of the things that we have implemented that I think will help a lot, and if it's something others want to do, by all means, we'll be glad to share that. But we have a questionnaire. So we have restricted business travel, as Lisa said, but we can't restrict people's personal travel, correct? So, but what we are doing is we're asking our partners, and again, a lot of this is based on self-reporting. We want to make sure that people are in touch and communicating with us. So if someone does leave for vacation or time away and they go to a hotspot area, we know right now Nashville is one of those areas. So again, what we're asking is when they do come back to work that they report to employee health. We have a questionnaire. We will check their temperature at the beginning of a shift and the end of a shift. So we're kind of making sure that we're monitoring those people, and should they experience any symptoms of this respiratory type illness, that they would self-report that, and then we would fall into the guidelines of putting that into family medical leave or whatever we need to do to make sure that people are taken care of. So.
Could you clarify that Nashville is a hotspot area to us that we're looking at, not a hotspot area according to the United States?
Correct, thank you, yes. So it's not just, I guess that when I think locally, that's probably a place that we can drive. But yes, there are, on the CDC website, that's a great place to go and look to see nationally what are hotspots as far as depending on where you're going, if you're going out of the country, or if you're flying, what airports are you going through, those kind of things. So we're kind of asking all those questions. Where did you go? Where did you come through? Where did you, all those different things to make sure that we want to make sure we're screening correctly. Obviously, if I just go, stay home for a couple of days, I'm not necessarily going to be screened. But again, currently, as we do not have any confirmed cases, that's going to be our practice. Is there any other questions from an HR standpoint?
Does the hospital have a hotline or anything? Do you have streamline any questions as people are calling? Is there one person to reach out to, or how do you all want people to handle that?
We will get a line. We have several call-in lines where it's leave a message.
Okay.
But let's see if there is truly something that we need to answer.
Right.
How I can get a dedicated line for someone answering questions. If there are clinical questions, there are questions that definitely go through to our health supervisor that, again, we're not giving medical advice over the phone, but it's if you feel that you need to see your medical provider, or if you are emergent and you need to come to the emergency room, that's our medical advice. As far as general questions about how do I find information about COVID-19, again, if you don't mind leaving us a message on our Find line, and that number is published out there for us, or Tori, do you know that off the top of your head?
It's 731-644-3463 is our phone line.
You can leave messages on our Find line, and we will get back to you if you could do that.
Perfect.
And I'll be glad to share what we're doing as far as screening and tools. I've emailed some of those to you already this morning. So if anybody has any HR, again, the bill's constantly changing, and sometimes when you read those bills, you need other HR professionals to help you interpret what those guidelines are, so that you make sure that you're following all those. So I'll be glad to share whatever information or questions and how we're handling that, because again, this is uncharted territory for most of us.
And if it would help, we are circulating frequently asked questions inside our own facility. If those types of things would be helpful, we'll certainly post them on our website for other businesses to read, because that may be pertinent to your employees as well. So we're glad to do that, and then you don't have to reinvent the wheel. You can take those questions that are pertinent to your facilities and your businesses and use them. We'll be glad to do that.
Yeah, because we have several, either calls or people coming in. What do I do about it?
Okay.
Where do I go?
Okay.
Yeah.
So we will, we'll put the frequently asked questions that we have already there. Those are geared towards our employees and their types of questions of, like Billy said, can I travel? What do I do if this? So we do have some of those questions on there too. So we'll put those out there for you, and then we'll try to pick up on some other general questions that may be asked in the public, and I'll get Lori to help me with that, and we'll put together some FAQs from the general public side. So again, we'll put those on our website.
So what are some good resources for businesses or human resource officers to look towards for maybe some of those questions and answers from that you've found so far?
Of course, SHRM, there's definitely those out there. Of course, we do ASHRA, which is geared towards healthcare. But I look at Littler. That's a good site. We use that through the THA. They usually have the pertinent information, and then they kind of break it down. So they kind of tell you, step by step. So I know they have an ASAP that they send out daily with updates of how to interpret some of these policies, because again, I think this is new for everyone. And so that's been a really good site. Still, the CDC is because again, when you talk about what are the signs and symptoms and things of that nature, your employees have to kind of follow that same guideline. So you want to make sure, that what are the things that someone's experiencing. Do they fall into this, or is it something else? Because again, we still have flu season and other things. So, but that's the main resource.
Could you restate that main resource?
It's Littler, Littler. It's a litigation support firm that, like I said, we do lots of things with them through THA, Tennessee Hospital Association. And they're really good to give us very good advice on interpreting the laws. If you look at that bill, it's 110 pages. And so it's very extensive. There's a lot in that bill with food, WIC, emergency food sources, not just, paying employees, but taking care of others, small businesses, and lots of things of that nature. So it's a pretty extensive. So I like that they kind of break it out to the main things that affect, depending on what industry you're in. So.
And one of the things that I read that was interesting, and some of the questions we've gotten was, just random questions. And some of the things I found online was don't throw your policy and procedure handbook out the window.
Correct.
That's what it's there for. Utilize it. But if they have questions that have, liability concerns or those types of things, just from an HR perspective, go to that website that you just spoke about. Any other resources that they can use to make modifications to their policy and procedure handbook?
Now I use, it's BLR. It's a company that we get our policies and procedures from. Jennifer's back there shaking her head. Again, that's a resource that I look at. I will tell you though, part of what they also say and recommend is do not change your current PTO policies. Because they're worried that people, especially companies over 500, change a policy so that they don't have to pay, which is going to get you in more trouble. So again, I think, all of those different questions, definitely, we can look at. And like I said, I'm willing to help how we interpret it as well. Because again, we're healthcare workers. And so that could apply, if they do have an employee that contracts this virus, now it's a workers' comp issue. So again, that could apply to other places as well. You're working side by side with somebody on the job. I don't know if Jennifer them are looking at, she's back there, how they're looking at that. But for us as healthcare workers, that's definitely a risk for us. So we have to look at all of those different pieces as well.
Well, two quick things that have come up on here. Tori, if you could repeat that phone number one more time. We've got someone on here that wants to write that down.
It's 731-644-3463.
Perfect. One more time.
731-644-3463.
Perfect. One other note on here, and then we'll kind of bring this thing to a close. If you guys could, we had someone request if you had some of these notes that you all are using, if you could put that on their website. They're taking notes as fast as they can, but if you could put that on your hospital website or some type of resource for them so they can go back and have those notes. So again, thank you guys so much. Thank the hospital and your staff for just answering the call so quickly. It helps the community feel at ease in this time. And so advice to members is reach out to each other. Reach out to other people in the profession, other HR officials, those types of things, and we're all in this together. And so, anything else you want to add, Lisa?
We're all in this together, and we have no idea how long this will last. None of us have a crystal ball on that, and let's just all try to stay as healthy as we can.
Yes, absolutely. All right. Thank you guys so much.